Good day. I'm Janet Marti Grande. I'm here to perform gavage feeding. So first, you need to confirm your patient identity and verify the doctor's order. In tube feeding must be ordered a physicians. The order will indicate the type of formula to be used, and of course the route and the amount of the to be administered and the frequency of feeding. And then after that, you should provide privacy to the entire procedure, then explain the procedure to the parents or guardian. The purpose of the gavage feeding is a way to provide the breast milk or formula directly to your baby's stomach. And then you should place the towel in the and then position first your patient in high Fowler positions in 30 to 45 degrees, and inform the patients or guardian to remain in this position to during 1 hour after feeding, to remain or to limit the risk of aspiration and reflux. Then you should wash your hand and don gloves and gather all the equipment with you. And then after you assemble all the equipment needed, you should check the placement of feeding to verify the correct placement of the tube in the stomach. Never administer a tube feeding until you are sure that the tube is properly positioned in the stomach. And you can see, I assume that my patient is baby. Then I position it in a high Fowler position and place it. I linen. In checking to check the patency and position, you should remove the cup or plug from the tube feeding, and you should examine you should use syringe to aspirate. Plug it and should pinch. And then close it. Then put it on the pH. The tube is patent if the aspirate has a pH of 5.0 or less. If the pH is higher, do not proceed to feed. So according to my pH tube, she is 5.0. Then another way to check if placement of the tube is obtaining is the X-ray film for the tube placement. And then you should assess the gastric emptying by aspirating and measure the residual gastric contents. If residual gastric contents, if the residual volume is greater than 150 ml or the predetermined amount is specified by the physician's order, and you should observe the abdomen for distension to assist in recognizing the gastric emptying and decrease the risk of reduration of pulmonary aspiration due to gastric distension. In administrative feeding, you should pinch the proximal end of the feeding tube to prevent excess of the air entering to the patient's tube. So I'm going now to administer or pour the formula into the syringe and allow the syringe to gradually empty. Open it. And then administer the 30. And then after that, after you pour the formula, you should flushing the water or the tubing with adding a 30 to 60 ml of water to and yun. 30 only. And then flush. And done. And this maintained to the patency by removing excess formula to occlude of the tube. Then after that, you should cover the end of the PD or the cap of the tube to prevent the leakage. After you cover it, remove all the excess equipment. So you should put it in the proper positions to not the tube is from the side to side, so then damage. So I remove discard the gloves, then perform hand washing. I use alcohol to sanitize. Then you should document everything you've done to your patient. You should document the time, the amount, and the type of feeding. And that's all how you feed doing the procedure of gavage feeding in the infant or children. That's all. Thank you so much.